लाइव सर।
ओके चल। चलो, गुड आफ्टरनून पृथ्वीराज, कौशिक, अंजलि गुड आफ्टरनून, ज्वेल, ओविया गुड आफ्टरनून, तमस गुड आफ्टरनून, गेमिंग, आकांक्षा, ईश्वरी, तुषार गुड आफ्टरनून। आफ्टरनून बेटा। ऋतु सकटिक गुड आफ्टरनून। या so yes, Abdul Salam, good afternoon. Anil, good afternoon. Today we are going to start a very important topic in anatomy, that is regarding the joints, right? Mrs. Meow, oh my God. Mutenet, Gaming, Sri Lakshmi, Abhishek, Diya, Hardeep, um, yes, memes, Prashant, Dinesh, Pavan, Sohail, Ashish, yes, there's so many students over here now. Yes. So without wasting much more time, let's start with the session, guys. Yes. Hmm. Afternoon, everyone. Now, so, afternoon. Let's start with the topic for today. Let's start with the topic for today. Yeah, joints. So put the heading as joints. First, we'll learn the basics about the joints, and then we will come to how you have to answer the questions in the exam. Okay. So yes, good afternoon to one and all. I mean, there are so many comments fronting off. So yeah, I couldn't reply. I'm not able to reply to each and every one due to so many comments. But yeah, definitely we'll be interacting through this chat box. Please try to keep the authenticity of the lecture, right? So yes. Afternoon. So write down. Firstly, hmm, now the definition of the joints. The definition of the joints. Good afternoon, everyone. Kindly focus on the content right now. Now, remember, guys, joint basically means it is the articulation. Now, when I say articulation, it is basically the meeting of two or more bones, right? It is in simple terms, it is the meeting of two or more bones of the skeleton, right? So you have studied the skeleton in detail in the previous lectures, right? We have studied all the important no bones, right? In detail, guys. So yes, there is meeting of two or more bones of the skeleton, right? And remember, guys, here the movement may be allowed or may not be allowed. Okay, so movements may be allowed or may not be allowed. So a joint is basically whenever two bones meet or more than two bones meet, right? At that particular place, either the movement will be present or the movement may not be present, right? So that's the definition of the joint. That's the definition of the joints. There is various ways, through which we classify the joint. But one of the ways through which we classify the joint, and that is again in your course, guys, remember, classification of the joints. classification of the joints. So over here, I am going to discuss the classification based on according to the nature of. Yes, good afternoon, everyone, guys. Please try to be with me. I will be drawing a lot of diagrams today in the joints as well. So I want every one of you to carry your color pencils, color pens, right? To beautifully draw the diagrams that I will be drawing over here in the joints part, right? The entire joints, I will be drawing so many diagrams, and I want every one of you to just go through the diagrams as well, right? So according to the nature of the tissue between the articulating bones. Now, when I say according to the nature of the tissue between the articulating bones, now let us suppose that two bones are articulating, right? Let us suppose that this is bone 1, and over here we have bone 2. So we have bone 1, and we also have bone 2. And as of now, just take an example that both the bones are articulating and they are forming a joint over here, right? Now the nature of the tissue which is present between them. Okay, so this is the tissue which is present in between these two bones, and based on this tissue we are classifying the joints into three types. Okay, based on this tissue, the nature of the tissue between the articulating bones, between these two bones, so it is divided into three types, and remember those three types over here. Yes, please try to make a flowchart over here and try to leave some space over here. Try to leave some space over here as well, right? So yes, afternoon everyone. Please try to be with me, right? So over here we will have the very first one, that is the fibrous joints. The fibrous joints. The second category of joints that we are going to discuss, it is the cartilaginous joints. Cartilaginous joints. And the third category of joints that we are going to discuss, it is the synovial joints. Synovial joints. Now, guys, in MCI, if you will ask me in upcoming future or next exam or MCI exam, joints is one of the very like important topics that has been asked since a decade. In every exam, at least two questions from this particular live session you can like expect. Two questions, minimum two questions you can expect from this particular live session. It is very like essential to go through this topic in detail. So we are going to start our discussion with the fibrous joints, then we will come to cartilaginous joints, and then we will come to synovial joints, right? So before going further ahead, just give me a thumbs up in the chat box, guys. I hope the audio and visuals are perfectly fine. You guys are able to see whatever I'm writing, okay? There is no glitch, nothing is there, right? So based on this, just give me a thumbs up in the chat box, and let's start with the very first one, that is the fibrous joints. Hmm, sure. Sure. Now, the ones who are not attending the session, I will be the one who will be checking the entire notebook in the next week. I will be the one who will be going through each and every particular word, and all the explanation that I'm giving you. If you're not able to tell in the oral exam in the next week, you will not be allowed for the midterm. If you are not attending the session live, it is your drawback, guys. because I won't be helping that person out in any case. Straight away, he will not be allowed to any midterm that will be conducted after 1 week. If you copy the notes and if you're unable to tell the answer in the questions that I will be asking in every batch I will be coming, then you better be aware that what will be the consequences that you're going to face. Now, let us start with the very first one, that is the fibrous joints. Fibrous joints. Now, the very first thing, what are the characteristics of the fibrous joints? Characters, okay, or characteristics of the fibrous joints. Remember that, yes, fibrous, beta fibrous का मतलब ही होता है, the word fibrous means it is hard. Okay, the tissue that is present, it is very, very hard. It is made up of fibrous tissue, and fibrous word wherever we are using in medicine, it is like very, very, very hard, right? It's very, very, very hard, right? So remember, the opposed bony surfaces are connected together by fibrous tissue. Are connected together by fibrous tissue, right? So you already know. Let us just, if we just try to see if this is bone 1 and we have bone 2. So whenever two bones are meeting, obviously there will be a formation of joint. And in between these two bones, basically the tissue which is connecting, it is nothing but the fibrous tissue. It is nothing but the fibrous tissue. So the first point is nothing but the post bony surfaces, whether it is bone 1, okay, bone 1, or whether it is bone 2. Both the articulating surfaces, they are connected by the fibrous tissue. They are connected by the fibrous tissue, right? Now, remember, over here, there is no joint cavity which is present. Very, very important. Next point. No joint cavity is present between the articulating bones. No joint cavity is there. There is no space which is present. The entirely in between, basically, we have a lot of fibrous tissue that is now connecting bone 1 to bone 2, right? The third important feature, guys, of the fibrous joint, that there is no movement which is allowed over here. No movement is present. No movement is allowed between the articulating bones. Between the articulating bones. No movement is allowed between the articulating bones. Okay, there is no movement. No movement is there, no joint cavity, and in between both the bones, there is fibrous tissue. Okay, so yes, there is fibrous tissue which is present. Now, put the heading as classification of the fibrous joints. Classification of fibrous joints. Now, fibrous joints, basically, they are classified into three types. Okay? They are classified into three types, and try to remember all the three types, guys, right? So they are classified as Yes, the very first one, let it be A. We have sutural joints. Sutural joints. The sutures, guys, that we already know. The sutural joints, right? The second one, we have syndesmosis. Syndesmosis. And the third one, it is gomphosis. Gomphosis. Now, the first thing that we are going to discuss over here, it is the sutural joints. It is the sutural joints that we are going to focus on. Okay. Then we will come to syndesmosis and then gomphosis. So we have divided the joints into three types: fibrous, cartilaginous, and synovial. Now we have again divided the fibrous into three types: sutural, syndesmosis, and gomphosis. Right. So let us now start with the very first one, that is the sutural joints. Sutural joints. Mm, or let me just try to make it on other page. Yeah, the very first one that we are going to discuss, sutural joints. Okay, someone is saying it is present in the skull. Okay, let me have a question for you guys. Okay, now these sutural joints, he told me that it occurs in which type of bones, guys? Sutural joints are found in which part of the skeleton? Which bones are these? Yes, gaming, it's right. It is the joints which occur between the flat bones. Yes, it is between the flat bones. So remember, the joints, they occur between flat bones of the skull. They occur between the flat bones. Let me just write it over. Yes, everyone is right. Everyone is right. I can see over here. Yeah. So remember that joints occur between the flat bones of the skull. Okay. The example is nothing but the skull bones, right? The example is nothing but the skull bones. Now, can anyone tell me how many skull bones are there in the chat box? I would recommend, can anyone tell me how many skull bones are there in the chat box? Hmm. How many skull bones are there in the chat, in the body? 11, 12. Okay. I mean, attendance is going on. 3P. Very good. चलो अब ये भी नहीं पता होगा तो फिर तो दिक्कत है. Now let us just try to draw a bone and just see. Now let us suppose that this is bone 1 and let us suppose that this is bone 2. This is bone 1 and this is bone 2. Let me just try to mention it as bone 1 and this is bone 2. Now both the bones are connected with the help of the ends of the bones. Basically, they are connected with the help of a ligament, and that is nothing but the sutural ligament, right? It is nothing but the sutural ligament. Okay. Now this sutural ligament is made up of fibrous tissue. Fibrous tissue. Now again, this makes common sense, guys. If the sutural ligament is basically the fibrous tissue, will there be any movement over here? Fibrous is hard. Can we move that particular thing? Obviously no. Right? Obviously no. Yes. 14 plus 8, very good. Jainath, Ramagri, very good. All like many of you have answered before as well. Yes. So yes. Over here, let us just first try to discover one by one all the types of the sutural joints also. The very first one, okay, the very first one that we are going to discuss over here. Hmm. Yes, we have plain suture joints. Plain suture joints. Now, when I say plain suture joints, let me just tell you with the help of an example. Okay, let us suppose that this is bone 1. This is bone 1, and let me draw bone 2 over here as well. We have bone 2 as well. Now, both the bones are connected together, so they will result in the formation of a joint. And in between the ends, if you just see the ends of these plates, I mean the articulating ends, basically they are plane in nature, guys. They are plane in nature. The articulating surfaces or the ends of bone 1 and bone 2, they are actually plane. Okay, so that's why they are called as plane sutural joints. And in between, guys, remember it is basically filled with this fibrous tissue only. It is filled with the sutural ligament or the fibrous tissue, right? So basically, it is nothing but the sutural ligament. Yes, sutural ligament or the fibrous tissue, right? And why it is plain, guys? Because the articulating end, if you just ask me why it is plain, because the articulating end of bone 1 and bone 2, they are plain. Okay, they're like very, very flat. They're just straight, right edges. So yes, they are called as the plane suture joints. The plane suture joints, right? Now, now examples are very, very important. If you ask me in the entire joints, what are most important are the examples. Are the examples. So the examples of plane suture joints. Try to write first, guys, over here. We have internasal suture. Internasal suture. Now, when I say internasal, inter means in between the two nose. I mean, okay, I mean the two nasal bones, right? Then we have intermaxillary suture. Intermaxillary suture. And the third one, it is the interpalatine suture. Interpalatine suture. Interpalatine suture. Now let us just try to see all these examples one by one. Right? Now I have a picture of the skull, and you already know this is the anterior view of the skull. This is the anterior view of the skull. You are watching the skull from front, right? So you can very well realize, guys, over here that this is one of the nasal bones. Okay, which I'm highlighting right now. This is one of the nasal bones, right? So according to the picture, this will be the nasal bone, left nasal bone, and this one will be the right nasal bone, right nasal bone. So you can very well see the joint which is taking place in the middle, guys, the joint which is over here. Okay, it is internasal, in between the two nasal, and this is type of, yes, this is nothing but the internasal suture. Internasal suture. Inter means in between the two nasal bones, the right one and the left one. Now, my question to everyone over here, is internasal suture a type of movable joint? Common sense. Is it a type of a movable joint? Is there any joint cavity which is present over here? Try to answer in the comment section, guys. I'm waiting for this. Try to answer in the comment section. Is there any no. Very good. Very good. Everyone is right. Everyone is right. Now, we have this bone that is called as the maxilla. This is the maxilla bone, right? And this is the left maxilla, and this is the right maxilla. Now, in between the maxilla, okay, we have a suture just in the midline, guys, just in the midline, and that is yes, this joint which is formed between the right and the left maxilla, it is called as the intermaxillary suture. It is called as the intermaxillary suture. And obviously it is not a type of okay, so there will be no movement which will be present over here, and it is a type of fibrous joint. In fibrous joint, which category? Sutures. Okay, and which suture it is? It is the plain suture, guys. It is the plain suture, right? Now we have a palate also, guys. Okay, we have a palate also, and remember, in between the palates, right, in between the palates, we also have a joint, right? And that is called as the interpalatine suture. Interpalatine suture. Interpalatine suture, right? It is called as the interpalatine suture. Interpalatine suture. So yes, we have the palates also. Okay. And in between the palates, the right and the left palate, we have the, okay, can anyone tell me where are the palates situated in our um, body? Yeah, anyone? So yeah, so that was regarding the very first category that we have discussed in, yes, that we have discussed in the sutural joints, in the sutural joints. And remember, yes, that is the plain suture joint. That is the plain suture joint, right? I hope this is clear to everyone in over here. So just give me a thumbs up if the plain suture joints are clear. If the plain suture joints are clear. Now, coming on to the next category, guys. Coming on to the next category. Hmm. Base of the skull, oral cavity, base of anterior cranial face. Very good. Yes. Sure. Very good. Now, plain suture joints, guys, one more point that if you want to mention, if you want to mention the definition also, guys, remember there is simple opposition. There is simple opposition where the bony surfaces are opposing each other. Okay. Simple opposition. The plane surfaces are there between bony edges. Between the bony edges. Okay. So yes, the interpalatine suture of the skull, or the intermaxillary suture, or the internasal suture. Now coming on to the next one, that is the serrate suture. That is the serrate suture. Now, yes, the next one. Now remember, guys, when we say serrate suture, Now, serrate suture are the ones where the bony margins have saw-like edges. Bony margins have saw-like edges. Let me just try to draw this. That's a very crisscross type of a pattern that you might have seen. Okay, it's a crisscross type of a pattern, right? So just try to see over here. Yes, this is like this. Let us suppose that this is bone 1, end of the bone 1. Okay, and we also have bone 2 over here. It will also have this crisscross or saw-like edges, sharp pointed edges are there, right? And let us just suppose this is bone 2, bone 2. And remember guys, in between we have this, yes, yes, the sutural ligament, right? That is made up of fibrous tissue. We have this sutural ligament because these are all types of fibrous joints only. In fibrous, we have sutures. So these are nothing but the sutural ligament. And remember the sutural ligament, it is made up of fibrous tissue. It is made up of fibrous tissue, right? Over here, we have to just look at the examples now. One example that I have to tell you, yes, we have the interparietal suture. Okay, we have the interparietal suture. Now we have two parietal bones. How to remember? You have always seen Pari, right? Pari, Son Pari. Okay, Pari means he or she always wears the crowns on her head, right, on the top. And over here we have the parietal bones, the right parietal bone and the left parietal bone. In the midline, they are joined together, forming a suture, forming a joint, fibrous joint. That is the interparietal suture, or it is also called as the sagittal suture. We have the interparietal suture or the sagittal suture. We have also discussed in the earlier session about the sagittal plane, the mid sagittal plane that passes just in between like the median axis of our body, the midline of our body, and that's why the name it is called as the, yes, the sagittal plane. Sagittal, the word sagittal, it is the basically the suture that is formed in the midline between the two parietal bones, right? So yes, let us just try to look over here, guys. Now this is the posterior view of the skull. This is the posterior view, and you can very well see over here, guys, that this is the right parietal bone, right parietal bone, and this is the left parietal bone, left parietal bone. Always write RT and LT just to make it's not lateral or something else. It is the left parietal bone. And in between, guys, can you see these sutures? This is nothing but the interparietal suture. Okay, it is the okay, let me try to, it is the interparietal suture. Okay, or it is also called as the sagittal suture. Sagittal suture. It is also called as the sagittal suture, right? Parietal bone हो गए तो, and in between they are forming a suture, that is the sagittal suture, also called as the interparietal, दो parietal bone के बीच में. I hope the serrate suture is clear. Why the name serrate? Because it is having these saw-like edges. The bony margins are having these saw-like edges. Okay. So I hope this is clear. Just give me a thumbs up if the serrate suture is also clear. If the serrate suture is also clear to everyone. Hmm. Anjali, very good. Yash, very good. Ishwari, Ruta, Mrs. Meow, Yash, Prithviraj, Palak, Crazy Boys, Anushka, FM, Gaming, Kiara, Shelly, Yana, Nishta, Sri Lakshmi, Kadambari, very good. Very good, guys. Cha- Let us move ahead with the third one. The third one in this category only. We are discussing sutural joints. We have discussed plain suture joints. We have discussed serrate suture. Now coming on to the third one. The third one, guys, right? We have squamous suture joints. Squamous. Okay, always just try to mention the joints also. The serrate suture joints, the squamous suture joints, the squamous suture joints. Hmm. Chal. Now, over here, what happens that one bony edge overlaps the other. One bony edge overlaps the other. The students not attending the session, be very clear, they will be facing a lot of troubles in the upcoming week. I'm telling you this for sure. If they fail to answer the questions, they will be facing a lot more of trouble. This is something I'm guaranteeing you guys. Now, when I say one bony edge overlaps the other, the one, let us suppose that this is one bone and this is another bone. Now, they're not meeting straight. They're meeting just one above the another. So yes, one will try to overlap the another bone and they are forming a joint like this. Okay. They're forming a joint like this. They're not meeting straight. They're one is just trying to overlap the another. Okay. Now, over here, just try to see that let us suppose that this is bone one. Okay, and let us suppose that this is bone 2. So basically they are trying to overlap one another, right? So yes. Hmm. So in between, yes, we will have this sutural ligament again. That is nothing but the fibrous tissue. Okay, so we have bone 1, bone 2, and the example that you guys have to remember. Yes, everyone is right. Everyone is right. Parieto-temporal suture. Yes, or it is temporoparietal suture. Temporoparietal suture. Now, in final exams of anatomy, basically there will be three questions, guys, right? The first question will be related to the bones. The second question will be of joints only. In all the tickets, you will have the second question named as joints. For that, also you need to understand what are the different classification of joints. Very important. Yes, and it consists of 30 marks. Okay, so if you don't like not attending this, so it's up to you. Temporo means the temporal bone and parietal means the parietal bone. Okay, it is in between the temporal and the parietal bone. So remember, guys, let us just try to see the lateral view of the skull now. The lateral view. Now this is the parietal bone, and this is the temporal bone. Now, in between the parietal and the temporal bone, see the parietal is basically trying to overlap it, right? Trying to overlap this. And this joint, guys, it is called as the temporoparietal suture. Temporoparietal suture. Temporoparietal suture. Temporoparietal suture. Now, how many temporoparietal sutures will be there in the skull? Again, you guys are going to answer me just the number. How many temporoparietal sutures will be there in the skull? So we have done squamous suture joints also. Hmm. Now coming on to the next category, guys. Coming on to the next category. Yes, the fourth one in the sutural joints only. Sutural joints are part of fibrous joints, right? So yes, two. They are yes, Anil, Ishwari, Tamas, Sri Lakshmi, Yash, Anjali, Priya, Manish, Kadambari, Rutu, Shreya, Yana, Crazy Boys, Palak, Samidha, Ravi, Gaming. I mean, so many comments. Very good, guys. Very good. Now let us try to understand one more category over here in this. The fourth one. Yes, we have the denticulate suture joints. Denticulate suture joints. Denticulate suture joints. Now, let us suppose that this is bone 1. You might have heard about the lock and key mechanism. Okay, basically they all like fit. It's just like a soapbox, guys. One fits into the yes. Let us suppose that this is the bony margin of bone 1, and they have denticulate like structures, and the second bone will be fitting into this, right? Just like the lock and key mechanism. So we have bone 2. Bone 2. Now, you have seen these tentaculate like facets are there. So yes, in between, guys, we have this sutural ligament, this yellow colored. It is the sutural ligament. That is the fibrous tissue only, right? And it is basically the example over here. Example over here, we have limboid suture. Example is limboid suture. Now, where is this limboid suture located? Now, let us suppose that this is the posterior view of the skull. Okay, we have the two parietal bones, right? The two parietal bones, they are joined together by the serrate-like sutures, that is the interparietal suture or the sagittal suture, right? So we also have one bone that is just behind this parietal bone, and that is the occipital bone. Occipital. So in between the parietals, both the parietals and the occipital bone, this Y-shaped suture, it is called as the limboid suture. Okay, this is the one which is called as the limboid suture. Okay, this is the one which is called as the limboid suture, right? Now, let's just try to look at this. We also have one image over here. Yes, you can see this occipital bone, and you can see this suture which is in between the occipital and the parietal bone. This suture, right? This is nothing but the limboid suture. Nothing but the limboid suture. Nothing but the limboid suture, right? So that was regarding this fourth category, right? And the final one in this category, guys, the final one in this category. So we have like sutural joints, the plain suture joints done, the serrate, the squamous, the denticulate, and the fifth one, it is shin dialysis. Be very clear with the spelling, it is shin dialysis. It is shin dialysis. It is shin dialysis, right? Now let us you might have seen the sphenoid bone, guys, right? Might have seen in the classes the sphenoid bone. So I'm taking the sphenoid bone, okay? And one important part of the sphenoid bone, the head part, that is the cranial part of the sphenoid bone. Okay. So this is the sphenoid bone, right? And yes, we have the cranial part of rostrum of sphenoid. Let's just try to remember this as of now. It is the cranial part of the rostrum of the sphenoid, right? So we have another bone that is just present beneath the nasal bones, right? And that is the vomer bone, right? This is the vomer bone. Okay. So in between, guys, we have this, yes, sutural ligament. We have the sutural ligament, and this joint, it is between the vomer and the sphenoid. So please remember the example as well. It is the vomerosphenoidal joint. Vomerophenoidal phenoidal joint. Vomerophenoidal joint. Vomerosphenoidal joint. So that is shin dialysis, right? Yes, shin dialysis. So it is between the vomer and the sphenoid, right? So these are all immovable joints. There is no joint cavity. And in between we have the sutural ligament. Sutural ligament is nothing but the fibrous tissue which is present. And that makes it very, very hard. Okay. So there is no movement which is expected over here. So guys, just trying to summarize this. We have discussed sutural joints, and in sutural joints, you have discussed, yes, the plain sutural joints, right? We have discussed, yes, the squamous, okay, the serrate suture joints. We have discussed the squamous suture joints. We have discussed the denticulate. We have discussed the shin dialysis. Shin dialysis. Okay, shin dialysis. So guys, we have discussed in fibrous, we have like three categories, guys, right? In fibrous, we have three categories: sutural, syndesmosis, and gomphosis. Sutural, syndesmosis, and gomphosis. And out of this, the very first one, that is sutural, we have already completed, right? We have already completed over here, right? We have already discussed it is the plane, right? The serrate, squamous, right? The denticulate, and shin dialysis. Shin dialysis. Shin dialysis. I hope this is clear to everyone. Just give me a thumbs up in the chat box, guys, if this is clear to one and all. The fibrous joints, I mean the sutural joints are clear. The sutural joints are done from my end. Now coming on to the next one, that is syndesmosis. But before that, just let me know if it is clear to everyone which is present over here. Sure. Ubaid, Wahab, Arhan, Ishwari, Yash, Anjali, Yana, Ravi, Umer, Kiara, Amjad, Mahesh, Gitanjali, Anushka, Shreya, Kadambari, Abdul, Princess, Yana, Gaming, Ubaid, Mutnet. वेरी गुड. बाकी सब कहाँ चले गए? दिनेश, वेरी गुड. परफेक्ट, परफेक्ट, क्रिस्टल क्लियर. ठीक. जयंत, पृथ्वीराज, मनीष, देवेन, ऋतु, ऋता, अनिल, मिसेस म्याओ, पलक, कृतिका, समीर, तमस, जयंत, दिनेश. Okay, perfect. Raj, very good. Very good. Now coming on to syndesmosis. So yes, the B1 that we are going to discuss, it is the syndesmosis. Sure. बेटा वो शिन डायलिसिस था और ये syndesmosis है. That was shin dialysis and this is syndesmosis. It is syndesmosis. Syndesmosis. Now, remember, the opposed bony surfaces are connected by interosseous ligament. They are connected by interosseous ligament. Now, when I say interosseous, beta inter का मतलब होता है it is in between the two, and osseous means bone. In between two bones. In between two bones. Ossai word is basically for the bones. So let us assume, okay. Now I'm taking an example over here, and let us just try to draw this over here as well. Let us assume that this is the lower end of the tibia. We have this tibia, and this is the lower end of the tibia. This is the lower end of the tibia, okay. And in corresponding to that, we have this fibula as well. Okay, so we have this fibula. So the lower end of the tibia and fibula are the long bones. Tibia and fibula are the long bones. So yes, the lower end of the tibia and fibula, they are connected together with the help of an interosseous ligament. Interosseous ligament. Interosseous ligament. Right? So the example over here, the very first one that you guys have to remember, it is the inferior tibiofibular joint. Inferior tibiofibular joint. Tibio means basically the tibia. We have omit A and we have written O. Tibiofibular joint. Tibiofibular joint. We also have middle radioulnar joint. Middle radioulnar joint. Okay, let's just try to look at this particular picture over here. You can very well see we have the tibia. This is the tibia and this is the fibula. The lower end, okay, this one, it is connected with the help of a ligament that is the interosseous ligament, right? So yes, we have superior tibiofibular joint also, and we have inferior tibiofibular joint. So basically the one which comes up, it is the superior. It is the superior. And the one which is below, it is the inferior. Remember, beta, it is the inferior tibiofibular joint. Okay, it is the inferior tibiofibular joint. And remember, yes, we have a ligament over here in the middle of the radius and ulna. Right, we have this ulna, we have this radius. So radius and ulna are having three joints: superior radioulnar joint, inferior radioulnar joint, and the middle radioulnar joint. Middle radioulnar joint. So the middle one, it is an example of syndesmosis. Middle radioulnar joint is an example of syndesmosis. Okay. Now we'll come to all other parts as well, but as of now, just try to remember. Yes, in the notes we have written it is the middle radioulnar joint. That was regarding the syndesmosis. Syndesmosis also over. So we have also completed syndesmosis. Syndesmosis also covered. Basically, the long bones, the ends are connected with the help of interosseous ligaments. Okay. Now the third one, that is gomphosis. Gomphosis, again, the name suggests gum. The name suggests gum. So let us just try to look over here. Yes, we have gomphosis. Now gomphosis is nothing but it is peg and socket joint. For example, let us just try to draw over here. We have a tooth, right? We have tooth, and tooth is basically fixed into the cavity called as the gum, right? We have a cavity. Let me try to make it more clear. Let us assume this is the tooth. Okay, and yes, below we have the gum, right? Below we have the gum, and basically the tooth is fixed into this gum, and the ligament, although it's a type of a fibrous tissue only because it all comes under fibrous joints only. This is the periodontal ligament. Periodontal ligament. And remember that this periodontal ligament, it is fibrous ligament. It is a fibrous ligament. So this joint, it is basically the peg and socket joint. Peg and socket joint, right? And it is articulation between the peg Peg basically means the conical process of the tooth. These cones, these conical part of the tooth. Okay, so basically it is the conical process and a deep socket that is formed by this gum. This is the gum, right? And a deep socket and a deep socket and a deep socket and a deep socket and a deep socket, right? So that was regarding the gum forces. That was regarding gum forces. So we have covered gum forces also. We have covered gum forces also. So in fibrous joints, basically the classification of joints we have covered sutural, we have covered syndesmosis, and we have covered gum forces. Now we will start with cartilaginous joints. Now we will start with cartilaginous joints. Fibrous joints, I hope it is clear to one and all. Fibrous joints entirely I have done sutural joints, plain, serrate, squamous, denticulate, shindialysis. We have covered syndesmosis and we have covered gomphoses also. So I hope this all is clear to everyone. Just give me a thumbs up in the chat box if this is clear to everyone. अब्दुल वहाब, 1 घंटा पढ़ते हो, 10 10 मिनट का ब्रेक चाहिए, बताओ कैपेसिटी क्या है यार। नीट की तैयारी कर रहे बच्चे भी 10 10 12 12 14 14 घंटे पढ़ते हैं। आधे तो वैसे भी टाइम जो नहीं अटेंड कर रहे, दे विल फेस अ लॉट ऑफ इश्यूज। आई तो पर्सनली एग्री विद दिस। बेटा पढ़ना तो है ही। we don't have any other option apart from studying, right? So that is up to you guys whether you want to be throughout the lecture or you just want to skip. And I'm guaranteeing you I will delete the lecture after the video. It is I will delete the lecture after the video to reply to your the students who are not attending the class. I will make this video private. And after checking the notes, if you're not able to answer the questions, and if you try to copy it from somewhere, then to just try to drink some water. Hmm. Chalo. We have to start with now cartilaginous joints. Now let's start with the next one, that is the cartilaginous joints. The second category, we have the cartilaginous joints. Now remember guys, the cartilaginous joints, okay, what are the features or what are the characters or characteristics of these joints? Remember that the articulating bones, articulating bones are connected together by an intervening cartilage. The articulating bones are connecting together by an intervening cartilage. Over there was fibrous tissue. Over here we have the cartilage. I will tell you how. We'll just learn, right? पर ड्रामा ही खत्म नहीं होता है. All kind of nibbas and nibbies are there. चलने दो. Remember that there is no joint cavity. And remember that there is no, or I would say, or limited movement. Limited movement is allowed in the joints. Is allowed in the joints. Allowed in the joints. No. So in cartilaginous joints also, guys, just try to focus over here that there is no space that is present in between the joints. Even the articulating bones. Let us just try to see over here if this is bone 1. And this is bone 2. Guys, just try to maintain the silence. If you, any one of you, if you want to go somewhere, Asif, please just don't try to break the decorum over here, right? I am strictly telling you, right? If you want to go anywhere, leaving the live, you can go. Don't try to interrupt the chat. Let us assume that you are doing a surgery at this time of a patient. Asif, will you leave the patient and you will go somewhere? Just don't let me speak something which will not look good. You don't want to study? Get the hell out of here. I'm really not going to tolerate anything. I'm telling you. And Asif, I'm gonna meet you very soon. Let us focus over here. We have bone 1 and bone 2. And in between bone 1 and bone 2, we have this intervening cartilage, okay, which will later on transform into bone only. So let us just try to first classify, and then I will tell you how it works, right? So the classification basically includes two types. We have primary cartilaginous joints. We have primary cartilaginous joints. and we have secondary cartilaginous joints. Secondary cartilaginous joints. We have primary cartilaginous joints and we have secondary cartilaginous joints. Now let us just try to do all this. Now we have started cartilaginous joints over here only. Okay, it's okay. So we have started cartilaginous joints. Now we are now going to study the primary cartilaginous joints. The primary cartilaginous joints. Now, now these joints are also known as synchondrosis. These joints are also known as synchondrosis. Now, chondro word beta, chondro basically means cartilage only. See, we haven't discussed how the bones are formed. See, bones are basically formed from two things, right? Either they are formed from the membrane. Now, when I say membrane, it is the mesenchymal membrane. Okay. Now, the process of bone formation, it is called ossification. Ossification. Ossification means formation of bone. Ossification means formation of bone. And bone formation, it basically takes place by two methods. It takes place by two methods. Either it is by membrane or either it is by cartilage. Either it is by cartilage, right? Either it is by membrane or either it is by cartilage. So the bones which are formed by membrane, the bones which are formed by membrane, that ossification, it is called as membranous ossification. Membranous ossification. And the bones which are formed by cartilage, guys, it is called as cartilaginous ossification, or it is also called as enchondral ossification. Enchondral. Chondro, what is basically for cartilage. Ossi, what is basically for, yes, ossi, what basically it is for the bones, right? And chondro, what is basically for the cartilage. It is called as enchondral or cartilaginous ossification. It is called as cartilaginous ossification, right? It is called as cartilaginous ossification. Now, either the bone, especially all the long bones of our body. Now, when I say long bones, I'm talking about the humerus, the ulna, the radius, right? I'm talking about the femur, the tibia, and the fibula. They all are formed from the cartilage. And which cartilage it is? It is the hyaline cartilage. It is the hyaline cartilage through which all the long bones of our body is formed. Except the clavicle, guys. Clavicle is an exception, right? Clavicle is showing both the ossification. See, the clavicle is the only long bone which lies horizontally, and it is the only long bone which shows mixed ossification. When I say mixed ossification, it means some part it is formed from the membrane and some part it is formed from the cartilage. Some part it is formed from for the cartilage. Now, yeah, the one who is controlling the chat, please just delete that. This person ko block karo yaar. Shocky Kurkuria. I don't know why these guys come on. I know you, any one of you it is, and I will try to figure it out, right? So I will try to figure it out who is it, and I will report it to the cybercrime. Remember this. Everything is getting recorded. It's a live session. You're forgetting it. Now, It is formed from the hyaline cartilage. Okay. Now, now when I say primary cartilaginous joints, now let us suppose that this is bone 1. Let us suppose that this is bone 1 and we have bone 2. Bone 2. Now both bone 1 and bone 2, they are connected together by hyaline cartilage. They are connected together by hyaline cartilage. They're connected together by hyaline cartilage. Now, let us just take an example of a growing bone. You already know the parts of the growing bone. Okay. Now you already know that this part, see the ends of the bones, they are called as epiphysis. Epiphysis. Then we have the diaphysis, that is the long part of the bone. That is the long part of the bone, that is the diaphysis. Diaphysis, it is also called as the shaft of the bone, or it is also called as the body of the bone. Then again we have epiphysis. Again we have epiphysis, that is the end of the bone. Now, in between the diaphysis and the epiphysis, we have metaphysis, which is located. Sorry. Yes, we have the metaphysis, which is located. Okay, we have the metaphysis, which is located. Now, in between the metaphysis and epiphysis, I'm talking about a long bone which is growing, This is called as the growth plate. Let me highlight this part. I've drawn the growth plate over here only. Remember this part, it is called as the growth plate. Now this growth plate, it is also formed from hyaline cartilage. Now this hyaline cartilage. Now there are two parts of the bone, guys, over here. If you just try to figure this picture out, you can see that this is epiphysis. This epiphysis behaves as bone 1, and this metaphysis will behave as bone 2. Bone 2. I mean the other part of the bone, the metaphysis, diaphysis, metaphysis, epiphysis. This is bone 2, bone 1. Now in between we have the growth plate. You might have seen children's, guys, the growing children's. Their bones are basically growing. Now we always say that no, the growth is limited up to a certain age, like for example 18 years or 20 years or 22 years. After that the growth stops. Now when we say growth stop, it means that the growth of the long bone is stopped, because this cartilage, the hyaline cartilage, will convert into bone. This cartilage will convert into bone. Okay, that is via the enchondral ossification or the cartilaginous ossification. Now, when this cartilage will convert into bone, this epiphysis will be fused with the metaphysis. This will be fused with the metaphysis. Now, that is why this primary cartilaginous joints, they are temporary in nature. Okay, they are temporary in nature. They are temporary in nature. So remember, guys, yes, the example over here, the first one, we have growth plate. We have growth plate. Okay. And that growth plate, it is formed from the hyaline cartilage. Hyaline cartilage. And remember, the primary cartilaginous joints are the ones. Okay, the primary cartilaginous joints are the ones which are temporary in nature. Temporary in nature. Okay. And they basically ossifies with age. They basically ossifies with age. Okay. As soon as the children is growing, I mean, the person is growing, right? Obviously, it will ossify with age. And obviously, they will form bone. They will form bone. They will form bone, right? One example we have written growth plate. The second example, it is again very, very important. We have costochondral joints. Costochondral joints. Costochondral joints. Costochondral. Now, when I say costochondral, I'm talking about the costal ribs and the costal cartilage. I'm talking about the costal ribs and the costal cartilage. Let us just try to look over here in this particular diagram. Yes, you can very well see, guys, this is the sternum. Okay, this is the sternum. And just next to the sternum, guys, this is the, yes, costal cartilage. And next to that, we have the costal rib. Costal rib. So remember, guys, as soon as this costal cartilage is growing, right? Obviously, if you see a newborn and if you see yourself, obviously your ribs also has grown, right? So that ribs are basically also growing. These are also these no flat bones, right? They are also growing. And that growing, that part, it is basically coming from where this cartilage only, the costal cartilage only. Okay, this cartilage keeps on no going undergoing ossification and it forms bone, right? So this costochondral joint between the costal rib and the costal cartilage, this joint I'm talking about, right? Between the costal rib and the costal cartilage. Yes, this one. It is an example of this. It will be later fused off, and basically a small amount of cartilage is left, and small amount of cartilage is left. So we have this the costochondral joint. Costochondral joint, right? So if there was a question that how many cartilages are present, there are 12 pairs of ribs, there are 12 pairs of cartilages, guys. There are 12 pairs of ribs, there are 12 pairs of cartilages, right? So that is regarding the primary cartilaginous joints. I hope this is clear. Just give me a thumbs up in the chat box if the primary cartilaginous joints are clear to all of you, right? Just yes, give me a thumbs up in the chat box if the primary cartilaginous joints are clear to all of you. Now, coming on to the next one. Yeah. The next one, we have the secondary cartilaginous joints. Yes, very good. अभी हम उन joints पे भी आएंगे तनवीर, we just have to wait for some time. We have secondary cartilaginous joints. No, these are also known as these are also known as symphysis. These are also known as symphysis. Now, let us assume that this is bone 1. This is bone 1. And we have another bone over here, that is bone 2. Now, the articulating part of the bones, they are basically covered with hyaline cartilage. The articulating ends of the bones, they are basically covered with this hyaline cartilage, both of them. So we have this hyaline cartilage. Okay. And in between these two, we have a small part of fibrocartilage. Now, in primary cartilaginous joint, only hyaline cartilage was there. But over here, guys, in addition to hyaline cartilage, we also have this fibrocartilage. You just try to follow the same color code, okay? Yes. Yes, we have this fibrocartilage. Fibrocartilage. Now, when I say fibrocartilage, guys, fibro means fibrous, basically means hard, right? So it will never ossify. It is very, very hard. And remember, it never ossifies with age. It is a permanent joint. Unlike the primary cartilaginous joint, which is temporary in nature, the secondary, it is consisting of this fibrocartilage in between. That's why it is a permanent joint, because it never ossifies with age. It never ossifies with age, and it is a type of permanent joint. It is a type of permanent joint, right? So that was regarding this, and yes, permanent joint, basically it will remain throughout life. It remains throughout life. It remains throughout lives, right? Now, examples are very, very important. They have been asked multiple number of times in the exam, right? They have been asked multiple number of times. Remember the examples. First one, manubriosternal joint. Manubriosternal joint. Just try to write it down, then I will explain. The second one, xiphisternal joint. Xiphisternal joint. The third one, intervertebral disc. The fourth one, pubic symphysis. And the fifth one, sacrococcygeal joint. Sacrococcygeal joint. Yes. Now, let us just try to look at this picture again and just try to understand this. That yes, please try to draw this picture as well. Now let us suppose that this is the sternum. Right? Now this part of the sternum, it is called as manubrium. Manubrium. This is called as the body of the sternum, and this is called as the xiphoid process. Xiphoid process. And this is basically the sternum that I have drawn. The sternum that I have drawn. Now, remember, guys, in between the manubrium and the body, this joint, the one which I'm highlighting in the picture, also this joint, it is called as manubriosternal joint. Manubriosternal joint. Manubriosternal joint. Okay, the one in between the body and the xiphoid process. This joint, it is called as xiphisternal joint. Xiphisternal joint. It is called as the xiphisternal joint. Right? This is called as the xiphisternal joint. Now, in between the vertebra, we have this intervertebral disc. Inter means in between the two. We have the intervertebral disc. Intervertebral disc. Right? Now, that we have done the 3-1, the manubriosternal joint, the xiphisternal joint, the intervertebral disc. The fourth one, guys, just try to see over here. You know, this is the hip bone. This is the hip bone, right? And this part is called as the ilium. This is the ischium, and this is the pubis. So you can see pubis basically meeting in the midpoint. So this joint it is called as pubic symphysis. This joint it is called as pubic symphysis. It has been asked multiple times. I mean, 3 times in a row. One time they have given an X-ray. One time they have given this image, and in one time they have simply asked that pubic, okay, I mean they have given the picture that it's a type of which joint, the pubic symphysis. It is a type of a secondary cartilaginous joint. It is a type of secondary cartilaginous joint. Very, very, very important, right? Now you can also see over here we have the sacrum and we also have the coccyx. So in between the sacrum and the coccyx, guys, in between the sacrum and the coccyx, yes, we have the sacrococcygeal joint. Sacrococcygeal joint. We have the sacrococcygeal joint. Sacrococcygeal joint in between the sacrum and the coccyx, right? If you just see, if you just try to see, guys, over here, if a small trick to remember all the joints, you can see all the joints are in the middle line of the body. The manubriosternal joint, the xiphisternal joint, the intervertebral disc in between the vertebrae, even the pubic symphysis, it is meeting in the middle, and the sacrococcygeal joint, it is in the middle. Below the neck, all the joints which occur in the mid-axial plane. Again, guys, I'm repeating the statement. Below the neck, above the neck, the internasal suture, intermaxillary suture, right? They are all plane suture joints. But below the neck, manubriosternal joint, xiphisternal joint, intervertebral disc, okay, the sacrococcygeal joint, and the pubic symphysis, all are secondary cartilaginous joint. All are secondary cartilaginous joint. So remember, guys, yes, below the neck, all are secondary cartilaginous joints, right? So just try to mention over here that below the neck, just for your remembrance, all joints occurring in the midline or the axial plane of the body They are all secondary cartilaginous joint. They are all secondary cartilaginous joints. They are all secondary cartilaginous joints. They are all secondary cartilaginous joints. They are all secondary cartilaginous joints, right? So that was regarding the secondary cartilaginous joint, the primary and the secondary cartilaginous joints. So I hope you have understood this. Just give me a thumbs up in the chat box. Meanwhile, I'll just try to complete the flow chart. We have done fibrous joints, sutural, syndesmosis, kymphosis. We have also completed cartilaginous joints, primary and secondary. We have also completed primary cartilaginous joints and secondary cartilaginous joints. Just try to give me a thumbs up in the chat box if it is clear to everyone. Sure. Now the third one which is left, it is the synovial joints. The third one which is left, it is the synovial joints. अच्छा चलो एक होमवर्क है तुम लोगों का, and I will check all the homework, guys. Coronal suture is a type of which joint? Coronal suture, it is a type of which joint? You guys have to answer this, and in your copybooks I will check this question. Coronal suture is a type of which joint? Right? Now coming on to the third and the last one, that is the synovial joints. Synovial joints. Hmm. Let's start with the third one. That is again the very important one. If the dollar sign लगा लो, just try to make dollar signs over here. It is again very important. So we are now going to start with the synovial joints. Cartilaginous done. Yes. Now coming on to the synovial joints. Now remember, guys, the synovial joints. Let us first try to write some important points about this. Yes. The characters. The characters of the synovial joints. Now, now the synovial joints, remember the opposed articulating surfaces. I mean, the opposed articulating surfaces are covered by hyaline cartilage. Are covered by hyaline cartilage. Okay. Now, we have the articular cartilage, which is basically the hyaline cartilage only. Let us just try to draw this also. Let me, yeah, try to draw this. Yes. Let us suppose that this is bone 1, and let us suppose that this is bone 2. Now, basically, obviously, two bones are the ones which will be now forming the joint over here, right? Now, over here, just try to look that, yes, the ends of these bone 1 and bone 2, Basically, they are covered by hyaline cartilage. Let us try to make it more simple, guys. The ones which are articulating, yes, they are covered with this hyaline cartilage. Okay, so remember we have this, yes, hyaline cartilage, which is a type of articular. It's basically the articular cartilage only, the one which is getting no the part of the bone which is getting no attached to the second bone over here, right? Now over here, guys, remember that this hyaline cartilage, it is highly smooth. Okay, it is resistant to wear and tear, right? So yes, I hope you guys are attending the session live and you are making the notes. I hope you guys are attending the session live and you guys are making the notes over here. Hmm. So yes, now this hyaline cartilage, it is highly smooth, highly smooth, compressible, compressible, okay, and it is highly resistant to wear and tear, to wear and tear, right? It is highly resistant to wear and tear, right? Now, remember, guys, that the ends of the bones, right? They are covered with, yes, in totality, they are covered with a fibrous capsule, fibrous capsule, right? Now, this fibrous capsule, it is basically made up of collagenous fibers. It is basically made up of a protein called as collagen, right? So it is the collagenous fiber. Now, remember, guys, even in the old ages, no a person no of like geriatric age group. Now, when I say geriatric age group, it is like 60 years above. So these fibrous capsules are the ones which are carrying the nerve sensations for the pains, and these are the first ones to deteriorate, right? So this is actually, it is also called as the watchdog of no these synovial joints, this fibrous capsule, because these are the ones which initially start to deteriorate in no response to any kind of degenerative changes that are taking place in the joints, right? So that is the fibrous capsules are the ones which are called as the watchdogs over here, right? Now the inner lining of the fibrous capsule, they are basically covered with, they are basically covered with this synovial membrane. They are covered with this synovial membrane. Okay, they are covered with this synovial membrane, right? And this synovial membrane, it is the one which will secrete a fluid, okay, in this space. Now, this space, it is called as the joint cavity, and the fluid secreted by the synovial membrane, it is called as the synovial fluid. synovial fluid. And remember, it is the synovial fluid, right? And the space over here, guys, space over here, it is the joint space. It is the joint space which is there. Joint space which is there, right? It is the joint space which is there. So yes, it is the joint space which is there. So I hope the diagram is clear for the synovial joints, and now we will be discussing the classification of the synovial joints. I hope the diagram is clear to one and all. Just give me a thumbs up in the chat box if the diagram is clear to one and all. Yes. Sure. Right. Very good. Very good. Nice. So let us now discuss the classification of the synovial joints. I can see many of you are commenting and you guys are like learning the concepts with me. So I'll put the heading as classification of synovial joints. Now these joints can be classified onto like a variety of parameters are there. So they are classified on the basis of according to the number of articulating bones, according to number of articulating bones. They are also classified on the basis of the shape of the articulating bones, according to the shape of articulating bones. They are also classified based on or according to the axis of movement. Axis of movement, right? Now, over here, first, the foremost, which is very, very important, and in the syllabus, guys, that is, yes, I will be discussing this. This is according to the shape of the articulating bones. And based on this, we are going to classify it, right? So the very first one, which we are going to discuss over here, it is classification based on shape of articulating bones. Based on shape of articulating bones. The first one, we have the plain synovial joints. The plain synovial joints. Now, when I say plain synovial joints, remember guys, the articulating surfaces are plain. If this is bone 1 and if this is bone 2, basically the articulating surface or the ones which are participating in the joint, these surfaces are plain in nature. These surfaces are plain in nature. Okay, so remember the articulating surfaces are flat. Articulating surfaces are flat. And the second one, right, the movement which is present over here, it is only sliding movement. Only sliding movement is present. Only sliding movement is present. only sliding movement is present and sliding motion is present, right? Let us just try to see this one. Okay, all the examples first. Okay, all the examples. Let us first try to figure out all the examples, guys. I'm writing all the examples over here. Over here, I will be writing out. Yes. The first one, it is the acromioclavicular joint. Acromio. You have heard about the acromion process of the scapula. There are three processes of the scapula, and I want every one of you to write down, all the students in the chat box who are listening, name the three processes of the scapula. And one of the process, it is acromion process of the scapula. It is the acromioclavicular joint. So this joint, it is between the acromion process and the clavicle. So it is acromioclavicular joint. Acromioclavicular joint. The second one, we have the intercarpal joints. Intercarpal joints. The third one, we have intertarsal joints. The fourth one, remember, we have intermetacarpal joints. Intermetacarpal joints. Then we have intermetatarsal joints. Intermetatarsal joints. Then the sixth one, we have superotibiofibular joint. Yes, Mutnet, Tamas Malik, very good. Yashasvi, very good. Very good, beta. Perfect. We have superotibiofibular joint. Mrs. Meow, Pavan, very good. Rutu Sakate, very good. Very good. We have superotibiofibular joint. And we also have sacroiliac joint. We also have the sacroiliac joint. The sacroiliac joint. Now just try to like focus over here, guys. You can see this is the clavicle. This is the clavicle. And this is the acromion process of scapula. Acromion process of scapula. Now this joint, which is in between the clavicle and the acromion process, it is a plain synovial joint. It is a plain synovial joint, right? So it is acromioclavicular joint. Acromioclavicular joint. Acromioclavicular joint, right? Now it is in between the clavicle and the acromion process of scapula, right? Now, guys, you already know we have, these are all the carpal bones. These are carpal bones, and I want every one of you to comment in the chat box how many carpal bones are there in the hand. In one hand, how many are there? In both hands, how many carpal bones are there? फटाफट से chat box में just try to comment how many carpal bones are there in both the hands, right? You can see we have the scaphoid, lunate, triquetrum, pisiform, right? It is trapezium, trapezoid, capitate, and hemate. Now, in between these carpal bones, in between these carpal bones, these joints, which is in between the carpal bones, anything which lies in between, it is called inter. Inter means in between. So these joints are called as the intercarpal joints. Yana, Anil, Princess, Vibes, Tamis, Ubaid, Anushka, Yashasvi, Devang, Dinesh, Amrita, Mahesh, Ronit, Angelina, Tamas, Rita, Yana. Very good, guys. Nikhil, Vaibhav, Ishwari, Arhan, Palak, Amjad, very good. Mahesh, very good. So yes, in between this, we have this intercarpal joint. And this intercarpal joint, it is also a type of a plane joint. It is also a type of a plane joint, intercarpal joint. Now, we also have intermetacarpal. Now, these are metacarpals. You can see this is the first metacarpal, this is the second, this is the third metacarpal, this is the fourth, this is the fifth metacarpal. We always start our labeling from lateral to medial side, right? From the lateral to the medial side, from the thumb to the little finger. So we have five metacarpals. We have five metacarpals, right? These are all metacarpals, and in between the metacarpals, you can see these joints are basically joining over here. So these joints are called as intermetacarpal joints. Intermetacarpal joints. And these are nothing but the plain synovial joints. These are nothing but the plain synovial joints. These are nothing but the plain synovial joints. Next one. Next one. If you just see, these are the tarsal bones. This is the talus, this is the calcaneum, this is the navicular, this is the cuneiforms, and yes, this is the cuboid. Right? So in between the tarsals also, right? So basically, yes, these are nothing but the intertarsal joints. Intertarsal joints, these are also the plain synovial joints. And you can see the intermetatarsal joints. So we have the intermetatarsal joints. These are also plain synovial joints. Metatarsal joints. These are also the plain synovial joints. So we have intercarpal, intermetacarpal, intertarsal, intermetatarsal. Both you should know by heart. We have discussed over here. Yes, this is the tibia and this is the fibula. We have two joints. The superior, it is called as the superior tibiofibular joint. Tibiofibular joint, and we have the inferior tibiofibular joint. You guys are going to see the notes and tell me inferior tibiofibular joint is an example of which type of joint. Meanwhile, superior tibiofibular joint, it is a type of plain synovial joint. It's a type of plain synovial joint. It's a type of plain synovial joint. Now this is the hip bone, and this part of the hip bone it is called as ilium. And this is the sacrum. This is the sacrum. Now we have a joint in between the ilium and the sacrum, and that is called as the sacroiliac joint. Sacroiliac joint. Yes, mutinate, very good. Arhan, very good. It is the syndesmosis. Sacroiliac joint, it is also a plain synovial joint. It is also a plain synovial joint. Is also a plain synovial joint. Yes, Palakvari, Angelina, Yana, Smeo, Prithviraj, Princess, Ronit, Anushka, very good. Very good, guys. So the sacroiliac joint, it is also a type of a plain synovial joint. Superior tubular for it is also a plain synovial joint, but inferior tibiofibular joint, it is syndesmosis. Basically, the long bones are connected together by the ligament, the interosseous ligament, right? The interosseous ligament. So that was regarding that. Yes, yes, everyone is right. Everyone is right. I can see the comments. Yes. So that was regarding the plain synovial joints. I hope this is clear to everyone. Just give me a thumbs up in the chat box, guys, that the plain synovial joints are clear. Just give me a thumbs up in the chat box if the plain synovial joints are clear. Sure. Very good. Now, second one, we have hinge joint. Hinge joint. Now, remember, the articulating surfaces, the articulating surfaces resembles the hinge of the door. डोर की जो मूवमेंट होती है, ठीक है? So you can just open the door or close the door. There is only movement in one particular direction. So remember guys, it allows movement in only one particular direction. It allows movement in only one particular direction. Examples. First one, remember we have elbow joint. Second, ankle joint. And the third one, interphalangeal joints. Interphalangeal joints, right? Phalangeal means the digits, right? Interphalangeal joints. Interphalangeal joints. Now, guys, try to listen over here. Now, you can see that this is a straight line, right? This is a straight line, right? What is an angle of the straight line? What is an angle in the straight line? It is 180 degree. It is 180 degree. Everyone knows this, right? Now, if I try to decrease the angle, it is called as flexion. In flexion, it is occurring at which joint? Elbow joint. Whenever I just try to decrease the angle at the joint, it is called as flexion, right? It is called as flexion. And when I try to increase the angle, I'm taking back it to the normal position. I'm trying to increase the angle, it is called as extension. So this elbow joint, it is hinge joint, which is allowing flexion and extension. Okay, it is allowing flexion and extension. Okay, so remember this elbow joint, okay, ankle joint, okay, or the interphalangeal, these hands you can see, right? The one which I can easily show, these are the digits. Right now it is just like a straight line, just like a straight line. And if you just do like this, you try to make it claw, billi ke panje jaisa, just try to form it like a claw of the kitten, claw of the cat, right? Obviously you're decreasing the angle, it is flexion, and if you take back to its normal position, it is extension. It is extension. So flexion and extension are the only movements that are allowed in this like hinge joint, remember? So it allows movement in only one particular direction, that is flexion and extension. Flexion and extension. And remember that flexion basically means decrease in angle of the joint. Decrease in angle of the joint. And extension means increase in angle of the joint. Increase in angle of the joint. Increase in angle of the joint. I hope this is clear, guys. एक thumbs up दे दो if you understand what is flexion. Flexion का मतलब होता है angle को कम करना, just to reduce the angle, and extension means to like increase the angle, right? Now, coming on to the next category of the joint. Yes, the third one. We have pivot joint. We have pivot joint, right? Hmm. Pivot joint, basically, it is just like a pole dance, guys. It's just like a pole dance. We have a central axis. We have a central axis through which the other bone is rotating. Now, we have actually two bones, guys, over here. One bone is basically forming the central axis, bilkul seedha khada hai, and the other bone is rotating around it. It's just like the pole dance, right? So we have the central axis, which is the bony pivot, right? And it is surrounded by a ring. It is surrounded by a ring, right? Surrounded by a ring, right? For example, guys, if you just see this, this is the forearm from elbow joint to the wrist joint. This is the forearm, and in the forearm we have two. Sorry, we have the two bones. We have the ulna and we have the radius. So if you're doing like this, okay, this is called as pronation. Pronation means basically moving the palm surface downwards. You always remember the palms are basically facing downwards. Okay, the palms, I mean, the pants are always down. So if the palms are going down, it is called as pronation. If the palms are coming up, it is called as supination. It is called as supination, right? Pronation, supination. Okay, pronation, supination. Now, if you do the hand like this, pronation, when you're moving the palms down, automatically this forearm will also move. Okay, so out of radius and ulna, basically the ulna will form the central axis and the radius will revolve around it. It will form a ring around it. Okay, so that is something that you have to remember. So remember that the examples are very much clear over here. We have superior and inferior radio-ulnar joint. Superior and inferior radio-ulnar joint. And one more example that I wanted to tell you, we have the median atlantoaxial joint. Atlantoaxial joint. So when I say atlanto, it means the atlas and axis. Now you guys are going to tell me atlas and axis are which bones? Atlas and axis are which bones, guys? Just try to tell me in the chat box. Yes. Atlas and axis are which bones? Mhm. Coming on to the next one. Yes. The fourth one. Condylar joint. हाँ, cervical. कौन सा C1 है कौन सा C2 है बता दो. Which one is C1 and which one is C2? We have condylar joints. Condylar joints, right? So yes. Hmm. Now over here I'm just considering bicondylar right now. Bicondylar. We have bicondylar. Example is temporomandibular joint also. We'll be discussing each joint in detail also in the classes, right? So, but over here, just try to remember that the articulating surfaces, everyone is right. Everyone is right. The articular surfaces consist of, okay, we have two separate convex condyles and we have two concave articular condyles. Now, what is meant by concave and convex? Now, better just try to see if it is a convex surface. The outer part, it is called convex. But when it is forming a cave, when I'm talking about the inner surface, it's forming a cave. Okay, गुफा जैसा बना, that is cave, right? So concave and convex, right? So remember, चम्मच का बाहर वाला जो part होता है, that is convex, and the inner part of the spoon, okay, that is concave, where we are forming a cave, that is a concave wala surface, right? So yes, example guys, you have to remember over here. Example, we have knee joint. Okay, knee joint, it is between femur and tibia. One, it is between femur and tibia, and one, it is between femur and patella. Remember, knee joint, it is not only between femur and tibia. Knee joint, it is not only between femur and tibia, it is also between femur and patella. Between femur and tibia. Second, remember, it is temporomandibular joint. Temporomandibular joint, very, very important. Again, a question of your final exam, the one which you will be having in the final. So that is again a very important question. Temporomandibular joint. It's between the mandibular bone and the temporal bone, right? So yes. So obviously we have. Oh, okay. Let's just try to figure out an example over here. If we just try to look at the femur bone. So yes, these are basically the parts which are coming out of the femur, I mean convex parts, okay? So we have convex condyles of the femur, and we have like concave condyles of the tibia. So this forming a cave-like structure, so it is the concave condyles of the tibia. So this convex part of the femur like fits into the concave part of the tibia, right? So that is again an example of this no condylar joint, right? Now coming on to the next one, that is the ellipsoid joint. Ellipsoid joints. So over here, remember the articular surface consists of concave oval surface and convex elliptical surface. Okay, just like the egg elliptical egg, right? So examples are very very important over here. बंद ही हो गया क्या lecture?
नहीं बंद तो नहीं हुआ है
Reconnection successful आ गया मेरे, एक बार देखना. The patch the
कनेक्शन एक्सीलेंट दिखा रहा है आपका फेस नहीं दिखा है आ गया ओके किंग स्टार्ट कर दो
10 मिनट का. अरे अब दिखाई दे रहा है सब लोगों को? फटाफट से बता दो. इज आर द ऑडियो विजुअल्स फाइन? चलो एक थम्स अप दे दो if the audio visuals are fine, then we'll continue, right? If we do have a lot of things to be discussed over here. चलो चलो वेरी गुड गाइस। देखो अब रेडियो कार्पल जब बोलते हैं बेटा, wrist joint, it is never formed between ulna, radius and carpal bones. Ulna never participates in the wrist joint directly. Okay, it is the radius and the carpal bones which are forming the bones, I mean joint, directly. So over here, remember guys, we have two carpal bones. We have two carpal bones which are forming the joint. Okay, we have the two carpal bones. We have scaphoid and we have lunate. We have scaphoid and we have lunate. Okay, and one more example that you have to remember, we have atlanto-occipital joint. Atlanto-occipital joint. Atlanto means the atlas, that is the C1, and the occipital bone, and the occipital bone, and the occipital bone. Let us just try to look over here, guys. Now you can see the metacarpals, and these are the phalanges. These are the phalanges, right? So you can see that they have an elliptical shape over here. If you can just see over here, they have an elliptical convex part, right? Just like the egg, right? So these joints between the metacarpals and the phalanges, these two bones are joining, right? This joint, it is called as metacarpophalangeal joint. It is called as metacarpophalangeal joints. Metacarpophalangeal joints. These are called as metacarpophalangeal joints, right? Now, we also have metatarsophalangeal joints. So you can see, yes, we have these metatarsals and we have this phalanges. So this, in between the metatarsals and the phalanges, this is the metatarsophalangeal joint. Metatarsophalangeal joint. Now we also have the radiocarpal joint. Let me just try to show you over here. You can see we have this radius bone, and we also have the scaphoid and the lunate. If you just more a clear view, you can see the radius. Radial, it is forming joint with the scaphoid and the lunate, some part of the lunate. So this joint, it is called as the wrist joint. Wrist joint. It is in between the radius, the scaphoid, and the lunate. You can see ulna. It is connected to the radius, but it is not connected to the carpal bones directly. There's some sort of space in between. Even in the X-rays, this is an important feature to know figure out which is the radius and which is the ulna, right? So that is again very important because ulna never participates in the wrist joint directly. We have the ligament over here which is not even shown on the X-ray. It is only the bones which are visible on the X-ray, and that's why we always get a space, interosseous space is there, right? In between the bones, a space is there, and we always figure it out. That's the ulna, and there is other bone will be the radius. Other bone will be the radius, right? So that is regarding this ellipsoid joint. The sixth one, we have saddle joint. Saddle joint, right? So I hope you guys have seen the saddle of a horse, the seat of a horse. When you sit, we have a convex part, we have a concave part, and we have a convex part. So it is kind of like concavo convex part, right? So we are, if we just try to figure it out, it is concavo convex part, more like this, concavo convex, concavo convex, just like the saddle of a horse. That's why the name is saddle joint, right? Examples are very important, and in this recent FMG they have asked this example, right? The recent FMG exam, the very first one, it is the first carpo-metacarpal joint. Carpo-metacarpal joint. Now, you guys have seen Carpometacarpal. This first one, guys. Let me just take the screen pen. This one. It is the first metacarpal, and we have trapezium over here. Carpometacarpal. Which metacarpal? It is the first metacarpal, and which carpal it is? It is trapezium. This joint between it is the first carpometacarpal joint. They have given an X-ray and they have asked you to identify the joint. Okay, metacarpal joint. It is basically a saddle joint. It is basically a saddle joint. Rest all the second, third, and the fourth. The second, okay, this this one, the second, third, and the fourth one. These are all plane joints. These are all plane joints. These are all plane joints. Right? Only the first one, it is the saddle joint. The first carpometacarpal joint, it is the saddle joint. Right? So that is you have to remember. Apart from that, yes. All more examples. We have sternoclavicular joint, and this is, I think you guys already know, it is between the sternum and the clavicle. It is a saddle joint. We have sternoclavicular joint. We have patellofemoral joint. Patellofemoral joint. Patellofemoral joint. And we also have calcaneocuboidal joint. Calcaneocuboidal joint. Now, you already know patellofemoral joint. This is the femur, and this is the patella. Right? This is the patella. So between femur and patella, okay, that joint is basically a saddle joint. Patella is present on the inferior surface of the lower end. I mean, not on the inferior part, okay, the inferior part of the femur, and it's just the anterior surface on which this patella is present. Inferior part and the anterior surface of the femur, right, on the lower end, right. So yes, so we have the patellofemoral joint. Okay. We also have calcaneocuboidal joint. You might have seen, we have discussed, this is the calcaneum. Calcaneum, it is also called as the heel bone. Calcaneum, it is also called as the heel bone. Between, you can see this is just like a saddle. If you just clearly see this image, guys, you can easily see over here. This is just like this saddle. Okay. Calcaneocuboidal joint, calcaneum and cuboidal. Okay, this is a saddle joint. This is a saddle joint, right? Coming on to the last category of joints, the seventh category, that is ball and socket joint. Ball and socket joint. Ball and socket joint. I think this is the easiest one, so I'm just telling the examples over here. We have only 4 which are present in our body, right? So please just write it down. We have the shoulder joint. The shoulder joint, it is present between the pear-shaped, this glenoid cavity and the head of the humerus, right? It is also called as the glenohumeral joint. Glenohumeral joint. Okay, you already know this. So let us suppose this is the scapula and this is the, yes, humerus. The second one, remember we have the hip joint. Hip joint, it is between the acetabulum and between acetabulum of hip bone, acetabulum and head of femur. Head of femur. The third one, we have talocalcaneo navicular joint. Talocalcaneo navicular joint. Now, talo means talus. Calcaneo, calcaneum. And we have navicular. So this joint, it is formed in the foot. Imagine ball and socket joint in the foot. Talocalcaneo navicular joint. Okay, talus, calcaneum, and navicular. Then the fourth one, we have incudostapedial joint. incutostapedial joint. Now, when I say incuto means incus, stapedial means stapes, right? We have incutostapedial joint. Incutostapedial joint. Now we have three ear ossicles. In ear, we have three parts: the external ear, the middle ear, and the inner ear. So, guys, you already should know that yes, between the incus and the stapes, right? Incutostapedial joint. This is an example of ball and socket joint. This was the question asked in the recent NEET PG exam 2023. Ball and socket joint, right? Malleus and incus. These are three tiny ossicles. Between malleus and incus, it is incutomalleolar joint, and it is a type of saddle joint, guys. It's a type of saddle joint that you have to remember. It's a type of saddle joint that you guys have to remember, right? So in ears, we have two joints between the three bones, the malleus, incus, and stapes, right? Incutomalleolar, it is a saddle joint. Incutostapedial, it is a ball and socket joint. Ball and socket joint, right? So that these are all the important ones that we have discussed, right? The ball and socket joint, right? Now, this gives a clarification of all the bones that I mean all the um, classification of synovial joints that we have discussed. So we have discussed over here the plain synovial joints. We have discussed the hinge joint, the pivot joint, right? The condylar joint, the ellipsoid joint. We have discussed saddle joint and ball and socket joint. So you will write all the names in the first flowchart, and that I will check personally in the homework, which I will be checking next week. I will personally come and check in all the classes. So yes, in synovial joints, all the categories, right? Plane, ellipsoid, okay, ball and socket joint, saddle joint, all these categories you will mention over here. All these categories you will mention over here. Apart from that, this is the first homework that I will check. Okay. In this flowchart, you have to mention, this is the homework, the first homework. In this flowchart, you have to mention all the joints, all the types of the joints, right? The plane, ellipsoid, condylar, bicondylar joints, right? Hinge joint, pivot joint. Okay. All those categories. Second question, second homework which I will be checking. It will be coronal suture. It is of which type of suture? Coronal suture, it is of which type of suture? I will be checking this. Coronal suture is of which type of suture? Second homework. Third homework. Third homework, and kindly listen what is the third homework over here. You have to draw these two images for upper limb and for lower limb. For upper limb and for lower limb. And you will be writing all the joints over here in one page. In one page, you will draw for upper limb, and in one page, you will draw for lower limb. This is homework 3. Now, how you have to do this homework 3? First, you have to write down the name of this joint. It is, yes, sternoclavicular joint. Sterno, between the sternum and the clavicle. Sternoclavicular joint. So you have to write the type of the joint. Okay, it is type is synovial joint. And you also have to write the subtype. It is which type of synovial joint? It is saddle type of a synovial joint. Then you have to write which are the bones participating. Bones participating. So it is between sternum and clavicle. Second, you have to write acromioclavicular joint. Then glenohumeral joint, elbow joint, superior radio ulnar joint, middle radio ulnar joint, inferior radio ulnar joint. All the joints you have to do. All the joints you have to do. Right? I will be personally checking that all the joints of the hand, this entire image, every joint, types, subtypes, and bones participating, you should know. Bones participating. This is homework number 3 for both the images, for both upper limb and lower limb. Okay. One I have shown you, you have to mark all the joints and then you have to like write it. Okay. And the fourth homework are these MCQs. The PPT will be shared to my Telegram channel, Docsmayan. Docsmayan will be my Telegram channel. After this class, I will be sharing the PPT to my Telegram channel. And these are the four MCQs that you will be doing. And this is homework number 4. Homework number 4, which I will be checking. Homework number 4, which I will be checking. Okay, these are the 4 MCQs, question 1, 2, 3, and 4. These are the 4 MCQs that you guys have to do. Use your brains and try to do it. And then we will be like discussing this, right? These 4 MCQs you have to do. Okay. So that is regarding today's session. I hope you guys enjoyed learning whatever we discussed today, all the 3 types of joint, fibrous, cartilaginous, and synovial joints. So yes, that's regarding today's session, and I hope you enjoyed learning. So thank you for your patience for listening me out, guys. Yes, I hope you enjoyed the session. Kindly share the video as much as possible. Follow the channel Anima Anatomia, right? On Instagram also, on YouTube also, right? Write down all the notes, write down all the homework, right? And try to show me in the next week and we'll discuss together. Okay? And this is the minimum you guys have to learn. Okay? So that was regarding the joints that we completed today. So please leave your feedback in the comment section below, right? I'm soon deleting this live chat as well. So kindly leave your feedbacks in the comment section. Any doubts, you can just text to me, or you can just put a question in the comment section below and I will be happier to answer it. Right? Thank you so much, guys. And thank you for your patience, everyone. God bless you.